Hello, I'm Chris Ordonez, Doctor of Physical Therapy and owner of Functional Flow Pilates. I am sharing you today some tips and techniques that I use when it comes to rehabbing patients with knee pain, specifically some knee pain that might be coming across the top and below the kneecap, as well a little bit on the side. I'm going to have you use a towel, so keep that nearby. We are going to learn some techniques on how to mobilize and also get some strength and length across that kneecap as well. So starting with a self-mobilization technique, I think the hardest part is learning where your finger placements are. So coming from behind is going to be your outer 1/4 of your leg. We have two bones in that lower leg. It's the outside one just below the knee joint. It's called your fibula. We're going to try to hook around that fibula head. So it's your outer 1/4. You want to make like a C-clamp and hook your thumb. So from your crease of your knee, come down maybe an inch and give that a squeeze. So it's going to look about here in that placement, okay? So hold that position. Keep it nice and tight. You're not on top, kind of off to the side and behind. You're going to pivot your lower leg in and out. See if you can feel some mechanical motion below your thumb. That should give you some indication if you're at the right spot. Now that you're there, give it a nice tight grip. We're going to translate that bone forward and back. So let your leg relax and your foot relax to the floor. And then you're going to translate slightly forward and pull back and forth. There might be some muscular tenderness, and that's okay. It's actually giving you some input that this will be a good move for you to do on creating some better mechanics just around the knee joint. So the knee joint itself should be able to rotate, as well as these two bones should be able to translate on each other. After about 5 to 10 of those, I'm going to have you also do another self-joint mobilization with the use of a towel. So let's make it a little bit long. We're not going to make it too thick. I'm going to roll this face towel up. It's going to go right deep into that knee crease, pretty high up there. And we're going to go to our knee joints here in kneeling position. So really wedge it in there. We're going to start with the tops of your feet flat to the floor. And then see what that feels like as you're keeping your ankles neutral and you're sitting back towards your heels or as far as you can go back without any pain. There might be some tenderness in that same space behind the knee. You're just going to go up and down, giving some input. That towel is creating some awareness and some mechanical motion in that knee that is stiff, and we're trying to just resolve the mechanics. So about 5 to 10 of those as well. And then you can progress by adding your ankle range of motion. Your toes are tucked and your heels are pointed up. Don't let them fall out when you go into that same down up position from high to low kneel. Again, within tolerance, nothing sharp ever. About 5 of 10 of these. Again, creating this motor control input, maybe potential gapping at the knee joint. And then from here, those are passive mobilizations. We're going to go through an active mobilization called a knee car. If you've worked with me, you're very familiar with this, but we have to get this done. You're going to hold your thigh up to you. You want to hold that thigh still. That thigh isn't compensating for your knees. So just be aware that you're deliberate and isolated at the joint line right below the kneecap. You're going to rotate externally of your lower leg. Bring it up to a hamstring stretch, a little shake, pivot, internal rotation, pull it right back down. About 3 of these. This is usually where people start to feel a little click or pop. That kneecap might be repositioning in the groove that it should be riding in when your knee bends and straightens. There's mine. All right, so now internally rotate, up, externally rotate, down. We're hitting reverse, internal, up, external, down. And then bring it down. So we did those mobilizations. Now it's time to strengthen and lengthen. We'll do it with what's called a thigh stretch, a common Pilates move here on the mat. We'll start with the tops of your feet down. You want to have your hips right underneath you so you're not too wide with your knees. Your knees are right in line with you. I want you to think about pulling your inner thighs into each other without actually having them to touch, and a little bit of a brace from your abdominals. From here, your goal is that your hips stay forward as you hinge just at your knees. You're lengthening out your quads, engaging and using your core to stabilize your spine. We're just going for a double front thigh stretch here. We're building up that length and strength, especially of that tendon from above the kneecap, which is your quad tendon, and then the tendon below the kneecap, which is your patella tendon. We're doing a progressive overload into building up strength of that muscular tendon. From here, you can progress. Same thing, toes tucked, ankles stay up. fight, hold with your core, and becomes more mechanically challenging as you're also increasing the challenge of your ankle mobility, toe mobility, all necessary to improve mechanics for you as you are a walking creature, right? We need to have mobility of the whole chain of events. So thigh stretch can be done in the same repetitions, 5 to 10. And those are tips and tricks that I do all the time for my people that complain about knee joint pain, improving the support system, but also the mechanics at the joint level, which I often see is overlooked. Hip strengthening is absolutely important. Make sure you pair this with hip strengthening exercises, building up that butt strength, supporting the knee and how it moves, but also clear the mechanics itself specifically at the knee joint. Hope that was helpful. Thank you for the request, and I'll see y'all next time.